past year and a half, the I-Team has looked into the creation of Florida's new Level 2 trauma centers opened by Hospital Corporation of America. In earlier reports, we uncovered HCA charges high fees the moment trauma patients arrive, and more than 100 instances where injured children were taken to the wrong trauma center where they often couldn't be adequately treated. Now, I-Team investigator Adam Walser introduces us to a former patient who is suing HCA, claiming the poor trauma care she received means she'll never walk normally again.
My husband was flying the airplane, and he ran an airplane out of fuel.
The nightmare began when Julie Fetko was flying with her husband John to his family's Christmas gathering on Christmas Eve 2012. The plane was ripped apart as he tried to make an emergency landing. During the crash, Julie was injured.
I felt my ankles break. When they broke, I felt it was like slow motion.
John died instantly after diving over his wife trying to shield her during the impact. When paramedics arrived,
they're telling that my husband's dead.
They loaded her on board a helicopter to transport her.
And I just laid there and cried until I got to the trauma center. I think I questioned which one was closer. And he said Ocala. And I said, well, that's fine with me.
Ocala Trauma Center had opened just 16 days earlier, one of Hospital Corporation of America's 6 new Level 2 trauma centers, which the I-Team has uncovered are the most expensive trauma centers in the state, charging an admission price of up to $33,000 the second a patient arrives.
What level of care would you say you actually received there at Ocala Regional Medical Center?
They just did not know what to do with me. Everybody seemed confused.
She had the kind of ankle fracture that nobody at that hospital, nobody who worked there and nobody who was available to them could fix.
Fetko's attorney, Pat Deacle, filed a lawsuit against HCA saying Fetko was medically stable to be able to be transported to any one of 3 nearby Level 1 trauma centers, the highest designation in the state.
Gainesville, Tampa, Orlando, all had the man to fix it. So why did they keep her?
According to the lawsuit, there was no orthopedic surgeon at Ocala. So medical director Dr. Darwin Ang, seen here testifying before the State Board of Health last year, attempted to realign her badly broken ankle bones in the trauma bay himself, even though he is not an orthopedic surgeon. The suit says another doctor who did not regularly do any work below the knee opened up, then closed her ankles, then attached external fixation devices.
But I had all these rods sticking out of my legs. They had drilled into my shins, into the tops of my feet. There were rods going through the backs of my ankles.
The lawsuit says the doctor who attached the devices recommended that the patient be transferred to a hospital or surgeon who could have properly treated her. But under medical director Ang, the request was refused.
They sent me home
with a big bill from HCA.
They billed me $186,000.
Still untreated more than a week later, Fetko says she was finally seen by a podiatrist referred to her by HCA, who also couldn't treat her. As her pain became nearly unbearable, Fetko's neighbor, a retired orthopedic surgeon, referred her to an ankle specialist at Tampa General. The lawsuit says the specialist wrote in his initial note, "I would like to state for the medical record that I've never seen a treatment like this before, and hopefully I will never see it again." He operated the next day, but the lawsuit says the delay made it impossible to properly treat her.
I've been through 7 surgeries, 1 adjustment, and I have 3 more surgeries to go because of what they did. They left my bones out of place without blood flow.
That's the only reason. And I've never, ever said that in 43 years about any case. This is all about money.
Fetko says she's in constant pain and will never walk normally again. A spokesperson for Ocala Regional said in a statement that Fetko's care was appropriate. She says the trauma center has treated 6,000 patients since it opened and has a 96.5% survival rate, which exceeds both state and national averages. I'm I-Team investigator Adam Walser, taking action for you.